feedback. And then if people need to speak, they can just unmute themselves and remute again.
Okay, so if you would kindly mute yourselves if you can, that would be great. And we'll probably flip back and forth to this agenda so we can see. I unfortunately had a technical difficulty here and my printer is out of ink, so I may have to reference it again in all honesty. So, well, good afternoon and welcome everyone. Most of you know me, but we do have a new member today that will be introduced. My name is Christina Nicholas, and I am the Director of Substance Use Disorder Services at Oakland Community Health Network. And this is our Oversight Policy Board meeting. First and foremost, since Shelley, you can't see the agenda, I will take us through that if that's what you would like me to do. We have the option for any public hearing comments. Okay, hearing no public comment, we could also offer that up towards the end of the meeting as well. Moving on.
Christina, I do have the agenda. I was able to locate it.
Oh, good. Now you can take us through the next. So right now, to let you know, Shelley, that what is on the board, the screen is just our public statement regarding making public comment. But at this point, I don't think we have anyone for public comment, so I will take it. We will go back to our agenda, and Shelley, if you could take us through the next.
Sure. Next, we have roll call. So, Christina, if you will call the roll, please, I'd appreciate it.
I certainly will. So this would be the time to unmute for a moment, board members. LaRon Coleman. I know he said he was coming, but I don't know if he's muted or not.
Can I just, Christina, this is Anya, just jump in and say for those people that did call in, if they need to unmute their phones, it's *6.
Thank you for that.
I'm here. Can you hear me now?
Yes, LaRon, we can hear you.
Okay.
Welcome and thank you.
Mm-hmm.
Kelly Flynn Daly Flynn, sorry.
That's all right. I'm here.
Hi, Kelly. How are you today?
Good.
I was reading my chicken scratch. I apologize for that.
That's fine.
Rabbi Benny had mentioned he could not attend today, so he is out. Ivana Maplunka?
I'm here. Good afternoon, everybody.
Good afternoon. Welcome. And Shelley Taub, you are here.
I'm here.
Dennis Yeager.
I'm here.
Hi, Dennis. How are you?
I'm good. All well.
Good, good. Okay, and then I would just like to take a moment to welcome Eric Lindemeyer. Eric actually is on our full OCHN board and graciously agreed to be on the Oversight Policy Board as well. Eric became a board member for OCHN in March, and we just want to welcome you, Eric, and also offer if you have any other comment you'd like to make or information regarding your background, or if there's just anything you'd like to say.
Thank you. Thank you for allowing me to be on the with the group. Just a little bit about my background. I've been in alcohol recovery for 11 years. Continue to go to 2 meetings a week and go to a panel discussion of one of the funded agencies every Wednesday night to discuss my experience in recovery.
Well, we are certainly very excited that you've joined the board and welcome you and look forward to your expertise moving forward.
Okay, let's go on. And Eric, welcome once again. Eric, perhaps later when we have questions, I'd like you to answer one for us. And that particular question is, are there group meetings now for AA and other groups or not? That's a major, or Al-Anon and such. That's a major concern of mine. But we're going to continue with the director's report. Christina, would you like to go ahead?
Certainly. And if Eric would like me to, I can also answer that question for you. So largely today's meeting is going to be related to the COVID-19 and our response both to people we serve, as well as what we are doing to support providers and also all of the individuals that work at Oakland Community Health Network. I think for most people, this is probably the hot topic for everyone because we're all experiencing it and it's very serious. So with that, what I would like to do is to introduce both our CFO and interim CEO, Anya Eliason, and also our Chief Operating Officer was able to join us today, Nicole Lawson. And both of them, with Anya starting, will be giving us an update related to what we've done to respond to COVID-19. And so with that, thank you very much, Anya, and welcome.
Okay. Hi, everybody. I'll go first, and then Nicole, if you want to jump in to anything you want to add, or I'll hand it over to you when I'm done, just for whatever I missed. But for those of you who don't know, we started pretty much immediately focusing on COVID-19 and kind of set almost everything else aside for probably the last, I don't know, at least month now. To try to put things into action to be able to allow and do telemed for any services possible. I know Christina's been really focused on MAT providers and the ability for them to still function and making sure that people still get medications. The other thing we've done is implement enhanced compensation for staff that are still working directly with individuals served. And also provided some opportunities for staff that don't feel comfortable going home, for them to stay in hotels and things like that. So we've really been trying to remove any of the barriers that exist during COVID-19, making sure that staff have the flexibility to serve people wherever and whenever they can, and also making sure that we are trying to remove any political or policy barriers that are in place, typically to make sure that people still get services and remain safe and healthy. Beyond that, from a funding perspective, we pretty much immediately moved providers over to what we would call a cost reimbursed contract. And what that means is during a time when the fee-for-service rates really are going to fluctuate pretty materially based on how much service providers are able to provide. What we do is basically move those contracts over to being fully reimbursed based on the needs of the services they're providing. So the idea being really just trying to take the concern about being able to make payroll and being able to fund their organizations during a crisis was really something we wanted to just get out of the way first. So we've been in the process of working on contract amendments to get everybody the language to support that. And we will be funding them at their expenses throughout the crisis and probably for a little bit of time afterwards. Nicole, what do you think? What else should we cover?
I think you covered after all the high level stuff on you. I wouldn't have anything to add.
We are a little bit of feedback from somebody, and I don't know who, but if you could mute everything.
Okay. I think you might have muted yourself. You did. I think the only thing I would add is that I know the the SUD team is working with providers directly, just troubleshooting any issues, certainly working with the people we serve. Sherry Williams, our lead clinical analyst, is taking a lot of calls from individuals who have questions or concerns. This has been a large change for the people we serve, especially moving to telehealth. It wasn't an allowable service prior to this, but our providers really did an amazing job of essentially in 1 week moving their entire businesses. Residential treatment and withdrawal management and MAT do have their own challenges. Sherry will talk a little bit about what's going on there. I can also fill it in. if there's any other questions. But it's been a combined effort and gone very well for the most part, really in quickly shifting how services are being run. And so
I wanted to thank Anya and her whole team because this is truly amazing what has, and you know, obviously our team is the whole group, substance use as well as mental health. I've never seen anything as amazing as this and the way you have responded. I just think it's quite practically a miracle.
So thank you very much for that feedback. I would stay directed all towards the staff. They've been amazing, staff and providers, just really pulling together and making this work for people served.
Well, Anya, this is Shelley again. Thank you for your leadership.
we are very fortunate to have the executive leadership team we have, and just our team as a whole, the entire organization. I would agree with that, and very thankful. Nicole, did you have anything you wanted to add in addition after I mentioned some things?
No, I think you all covered it.
Okay. All right. Well, thank you. If we could go back to the, oh no, Shelley, you do have the agenda in front of you again. That's true. But go ahead, Shelley.
I think we're going to go to treatment reports, and I will say this, Sherry Williams, I bet you're glad you're not having to visit Biomed anymore.
Good afternoon, everybody. And it's just refreshing to see faces and to hear voices during this trying time. And yes, Shelley, I am pleased that I do not have to be there anymore on a regular basis. So thank you for that. As Chris and Anya discussed, telehealth services are being provided across the network. Withdrawal management and residential providers have also adjusted capacity to ensure safety for staff and individuals served. Our medication-assisted treatment programs are following established protocols by SAMHSA and OROSC related to social distancing and the expansion of medication off-site dosing privileges. And I'm just going to say that our providers have truly been cooperative, flexible, and adhering and implementing the OCHN guidelines related to service provisions. And as Christina mentioned, I'm constantly triaging calls from individuals being served and providers, just reassuring them that services will not be interrupted. It just looks differently, but services have not been interrupted. And, you know, the saying is dream work makes the team work, and it is definitely happening across all services being provided at OCHN. So thank you to everyone that is helping us in that effort. But it has been challenging, but we're getting through. Any questions for me? Okay.
Sherry,
Thank you.
Sherry,
Yes.
could you just in case people listening or for our new member, could you say what OROSC is and SAMHSA?
Oh, absolutely. And also welcome, Eric. I'm Sherry Williams, lead clinical analyst on the Substance Use Service Network team. So my apologies. SAMHSA is the Substance Abuse Mental Health Services Administration. So they're the federal entity that provides guidelines for behavioral health services and oversight. And OROSC is an extension of the Michigan Department of Health and Human Services, and it is the Office of Recovery-Oriented Systems of Care, and that is the entity that that provides guidelines and expectations for substance use services at all PIHP levels. Thank you, Christina.
Thank you.
Yeah, thanks for the explanation. I appreciate the consideration for me being a newbie.
You're welcome. And what's interesting, Eric, is that I had all that information documented here and I forgot to say it. So Christina, thank you for the reminder.
No problem. Okay. There are no questions. We can move on, Shelley. I think you're on mute. Okay, I think Shelley might be having some trouble with her microphone for some reason, which does happen sometimes. And so I'm seeing, oh, go ahead. Thank you, Shelley.
Eric, well, see, there's two kinds of mute, one on your phone and one *6, and hopefully I'll get it right. Eric, we won't give you a test today, okay? Next, we're going to hear from Megan Phillips, Access Supervisor. Sorry. Megan?
Yes, hi, thank you so much, and hello and good afternoon to everyone. My name is Megan Phillips. I am the Supervisor of Access. So what I have to share with you today, with the governor's stay-at-home, stay-safe order, our Access staff that works on site at the Resource and Crisis Center, they have moved to working remotely and working from home. So that means that predominantly our SUD screenings, our substance abuse screenings, we would do most of them in person. And the large reason for that was the need to obtain a signed release to be able to care coordinate all the different pieces of treatment for an individual. So we moved everybody home. They're working remotely. All of our screenings are being done via the phone. We do have one person on site at the RCC because Access is a forward-facing function to the public. And so we do still have people walk in the front door on occasion seeking either mental health or SUD services. So we have somebody here, that way they're able to assist with any type of issue that may arise. The Sober Support Unit is fully operational here at the Resource and Crisis Center. People are accepted in 24 hours a day still, 7 days a week, and they are still being placed at higher level of care providers, withdrawal management, residential within 24 hours. The RISE Center is sorry, I was getting a little feedback. The RISE Center is also operating remotely, and those case managers are able to assist individuals with any type of RISE Center case management needs. If there's a need to obtain insurance benefits, they are able to assist the people over the phone, and they're having releases signed via DocuSign.
Thank you, Megan.
No problem. Any questions?
I think you're doing wonderfully well, amazingly well. Thank you so much, Megan. I don't know how you guys get this. Are there any questions for Megan? Okay. Prevention reports. This is our new prevention person. Whoop.
Yes, this is Rachel Rhodes. So due to the COVID-19 and the current stay-at-home, stay-safe order, ORAS, the Office of Recovery Oriented Substance Abuse Services Center sent out a document for the prevention providers on how to report prevention virtual services in the Michigan Prevention Data System, MPDS. And many of the providers are learning to link to think of prevention in new and innovative ways. So they are adjusting and adapting well. And as of right now, they do not foresee any staffing changes or any challenges that they experience. And our team is addressing and helping them to solve them. All providers are working remotely except Common Ground, as their face-to-face services is essential. They submitted their mid-year reports and their business continuation action plans, both of which we currently are reviewing and going over those. There is a listening session and strategic discussion webinar series that will take place starting April 22nd, so today, and it will run through mid-May. And so that webinar series will focus on how COVID-19 is differentially impacting substance use prevention, treatment, and recovery. And the webinar series will be facilitated by Addiction Technology Transfer Center Network, ATTC, and Prevention Technology Transfer Center Network, PTTC, as well. So that is all that I have as far as updates for you.
Okay, are there any questions at all? No questions? Well, I think, Christina, Thank you very, very much to our new prevention specialist. We appreciate that. And one day we'll all be able to meet you again. And Eric, I've lost my agenda, but I think, Christina, you're the next person up.
Well, a couple of things that I did want to talk about before, just in the interest of Eric coming on for the first time and also being a new OCHN board member. So one thing, Eric, and to remind everyone, certainly, one thing, Megan Phillips mentioned the RISE Center. The RISE Center stands for Recovery, Information, Support, and Education. It's generally housed within the Resource and Crisis Center, and it's open 5 days a week from 8:30 until 5. And it is manned by case managers and individuals in recovery. And you don't need an appointment. You can walk in, you can call, and anyone in Oakland County. So people have come in just to talk about recovery. A lot of people come in to receive assistance applying with numerous types of benefits, whether it's food benefits or if Healthy Michigan or Medicaid, you name it, clothing, food, housing. And so we have that just as a community benefit because we saw it as a real need, and it is part of our recovery-oriented system of care plan to have both formal and non-formal supports. The RISE Center has been going very well. They service many people on a daily basis. It has been a shift, as Megan talked about, in the interest of safety and the governor's order. They are all phone right now. They hope to get back in the office in due time, but they are completely up and running and just handling everything by phone at this time. In addition to that, Megan mentioned the Sober Support Unit. Everyone on the board is very familiar with that, but being new to the board, you may not know. Sober Support Unit was approved by the Oversight Policy Board and is funded by our Public Act 2 funds, which are liquor and convention facility tax funds that each county receives to support substance use services. The Sober Support Unit is not a licensed service. It is a community benefit as well, and it is a crisis unit per se, or just a unit that anyone can enter at any time when they would like higher level of care, substance use services. And so that means someone can come in at 2 a.m. It means someone can come in at Christmas, all times, day or night, weekends, holidays, can come in when they feel ready and need treatment. And they are monitored by recovery coaches and paramedics. And within less than 24 hours will be transferred to the appropriate level of care for their needs. And so I wanted to just give a brief explanation on what the RISE Center and Sober Support Unit are. So they are mentioned regularly, and in the event that we didn't have a chance for me to do a larger board presentation prior to our next meeting, I wanted you to have that information. Do you have any questions about those two services?
Yes, I do, Chris.
Yes.
About funding. You've known me long enough to know that. But this is funded by primarily hotel, motel, taxes, and taxes from COBO or whatever it's called now. I've forgotten. Doesn't matter. We are not having any of those things happening. So our tax revenue will probably, for this year, be way, way down. Are we thinking about this as we do our next year budgeting?
So we will wait and see. That is certainly something that is not new. With the last recession, we experienced decreases in the PA2 as well, and then they build back up. One thing I am seeing, which is not a positive thing necessarily, but that liquor tax sales have actually increased significantly. That is very concerning from a public health or a mental health standpoint. I don't know as much how that will impact the PA2 funds, but you're correct with convention facilities. People are not staying in hotels. At this point, though we do have a fund balance, and we have that fund balance for a purpose. They are for reserves. We will certainly take a look at how it is impacted this year. However, we do have funding to maintain the full level of services. And then when we budget for next year, we will certainly take a look at that as well.
Okay, thank you very much. Is old business your next thing, Christina?
It is the old business. So if we could look at some vacancies. And so, there is no set parameters around the vacancies. These are just what we have lost in terms of individuals that served on our board. And actually that can be a bit updated because we did receive word that Lauren Chamberlain from Veterans is not able to continue on the board as well. It was always wonderful having a representative from Veterans. We will look to see if we can have anyone that's either a veteran or a family member that's a veteran or from some other veteran services in the future. We are lacking at this time someone that has really worked long-term in prevention. And so we did have that. That's something we've been looking for a long time. Part of, the reason why I think this is difficult is that we contract with so many prevention providers. And when the law pertaining to the Oversight Policy Board came out and the direction on who was on your board, it was that you could not have conflicts of interest. And so to have individuals that are primarily running the prevention programs and we're funding them is considered a conflict of interest. So that's one of the things and reasons why. We always are looking for people in recovery or a peer recovery coach. We do have peer recovery coaches currently and individuals in recovery on our board, so that is very helpful. We have had recently, there were 2 applications. They have not been reviewed yet and will be reviewed to see who has applied to be on the board, and a determination will be made is in terms of if they are appropriate for the board. So again, I always say this at every meeting, if you know of anyone that would be interested in serving on the board and meets any of these, possible affiliations, or just is interested because of a family member that's in recovery, themselves in recovery, or they've been involved in advocacy, etc., we encourage them to go to our website and apply. There was
Okay,
one.
Hi, this is Kelly.
Hi, Kelly.
So I have a friend who is a peer in active recovery that has received a lot of services. So if we don't find someone for that position, I'll recommend her maybe in next meeting or meeting after. She's relapsed again, and so I'd like her to get more sobriety. But that position, hopefully, if it doesn't get filled, I'll be able to recommend someone for that.
Okay, great. Thank you so much, Kelly. I appreciate that.
Does anybody else?
There was one thing I wanted to add that I think if anyone wants to look at that is been very helpful for people, as especially our providers, is that we have a web page on our website. And if you go onto our website, you will see in the upper right-hand corner, unless it's changed, it'll say COVID-19, or maybe it's on the middle of the page now. And you click on that, we have a web page entirely dedicated to COVID-19, provider resources in general, including recovery resources. But I did want to go back to Eric. I'm not sure if you wanted me to answer the question about online resources or if you wanted to speak to that because it was directed towards you by Shelley.
So the question was, what are people doing that are in recovery? Are they meeting, or what are they doing as an alternative? Is that right, Shelley?
Yes, that's absolutely correct, Eric. Thank you.
So So initially, what had happened when the virus came, and there was an order. Some people continued to meet, and there were. I'm going to go into a little bit of the weeds, but I think it's important for some reason. Some people were continuing to meet in churches and other places, and there were some discussions with the groups that run meetings, and eventually, for the most part, they've all went to like Zoom meetings, so that people can still have AA meetings online. I have not personally done any AA meetings on Zoom because I am much more of the type of person that has to or prefers to actually see somebody and talk to them and have a more personal connection than doing things online. So for me, what I do is I tend to call and talk at length with other people that are in the program. So, one of the important parts of the program is to hang around with other people that are in the program so that when crises like this come up, you can call and talk to people. And so you're not just going to meetings and then just drifting off onto your own. But some people are meeting in a park and sitting 6 feet away from each other, which I don't think is advisable, but that's what they're doing to remain sober. But for me, I've been in the program for 11 years. I don't go to meetings so that I don't drink. I go to meetings so that I can function better as like a human being. And that's what the program is. It's not all about just quitting drinking. It's about how to make yourself a better person when you're not drinking. What I worry about are the newcomers that get disillusioned so easily. And it's when you're doing things through Zoom and you're not, you don't have like people holding you accountable face to face. And so I really worry about the effectiveness of these meetings over Zoom. It's clearly better than nothing. But to me, it's getting pretty close to an essential service, especially for newcomers into the program. And so I'm torn between these meetings being done on Zoom and whether or not we should be allowed to try to meet in small groups in some way.
Excuse me, Eric, that was my concern. There's a certain amount of, I'm in your face and I'm right here and you can't wiggle and jiggle around meeting, okay, versus the very state. Can you hear me, Eric?
Yes.
Okay, rather than being on a TV screen. And my concern also is, what about the person who doesn't have the ability or doesn't own an iPad or a computer or what happens to that?
Hi, this is Kelly.
Thanks.
So is it all right if I talk or?
Yes, please.
Yeah.
So I am in recovery for Eric's sake, and I went through a lot of anxiety when I discovered the meetings weren't in person. And so I contacted the Michigan Department of Health and Human Services and asked them, can meetings continue in person? And they responded yes. They said that it falls under the part of the executive order for preventing psychological harm. Now, mentioning that, our Alano Club stayed open for the first week until the more restrictive executive order came in, but then it closed because nobody wants to risk opening, and there's a lot of criticism regardless. Even if you are careful, people think you're being irresponsible. But I still go to in-person meetings that are held at a private location. There's social distancing, which the MDHHS said that if you meet it, you have to meet those requirements. It's not publicized because of the disapproval and criticism. But if anyone was, interested, could contact me individually, and all are welcome. So it is acceptable to meet in person per the Department of Health and Human Services.
But, sadly, that's not made public. And
No.
Kelly, thank you for taking the step of calling them, because I've been worried about this since we shut everything down. I don't think a lot of people know that.
No, nobody
Eric,
knows it.
Eric, did you know that?
No, I didn't. And so I really appreciate, that's I guess the value of being able to at least meet and learn about these things.
Mhm.
I wouldn't have known that. I really appreciate Kelly stepping up and following through on that information. I do find it interesting. Maybe if I was participating in some of these Zoom meetings, I could talk to people about that.
Well, we haven't publicized it just because, like I said, of the criticism. I have the email from them, but even if you look at their FAQs, where a lot of people have asked questions, they don't clarify. They say people can meet for the purposes of psychological harm, but they don't expand on that. So it's not specifically stated. Like they've stated some other things. They've clarified some other things in public. So I think if they would have stated it formally, people would feel more comfortable. But the way it is right now, it's kind of it isn't well known that you can do this.
It would be maybe I'll get that email from you. So,
Okay.
because people in my home group, I wasn't part of it, but people in my home group told me that there were some harsh feelings going back and forth because people had really specific feelings about whether or not my home group should continue to meet in this church or not. And alcoholics and drug addicts will fight everybody's got their opinion.
Yep, I know. From what
Part
I've
of the program is let go and let God, right? So that's what I do. I just do what's best for myself. But it's when people are struggling with addiction, you hate to see these kinds of barriers put up in front of them because it makes it more difficult. And I think Shelley, I think you have a good point about the new people that are really struggling, that aren't held, that they can't be held accountable. I would imagine that there are people sitting in Zoom meetings, AA meetings, that have a drink next to them while they're drinking while they're in the meeting.
Well,
that might sound harsh.
Yeah, I'd agree. I totally agree.
That's the kind of things that people in addiction do.
I'd agree.
And that's why I've been losing sleep about this, because I get it. I understand it. And I'm troubled by it. And I think it should have been a carve out, or whatever Christina uses the word, I think, carve outs sometimes, or whatever. I think there should have been specific in the governor's issuances, okay? It can be done safely. You can be 10 feet apart. Who cares, okay? But I still do have concerns. I think are there any other comments on this issue from anybody? Well, okay, I think next I need a motion from someone and a support from someone, a second, to approve the January minutes. Do we have a quorum, Christina?
We do, according to how many people we have on the board right now, yes.
Okay.
Yep,
we have a motion from Kelly. Are you there, Kelly?
Yeah, sorry. Motion to approve January minutes.
Yes. And do I have somebody who's going to second that?
I'll second it.
Who? Give me your name.
Dennis Yeager. I'm sorry. Sorry, Shelley.
Hi. I'm sorry, Dennis.
I thought you were online also.
I can't be because I don't have I'm in a room where the computer has no.
Yeah, I understand. Yeah.
Okay. All right, I have a support and I have a second. All those in favor, please say aye.
Aye.
Opposed, same sign. Motion carries. The minutes are approved. Okay, Christina, other announcements from people.
Okay.
Are there other announcements?
I'd like to say something,
Tell us who you are.
okay?
It's
Okay.
Dennis, Shelley.
Yes.
Okay.
Southeast Michigan AA is Area 33, and if you go to their website, they have some information on the Zoom meetings, and they have a meeting list of Zoom meetings that'll be meeting throughout the week. So if for those that can access that and find it helpful, that's where the information's at. It's Area 33 of AA. Thank you.
Thanks,
Yes,
Dennis.
and also on our COVID webpage, we've listed all the types of meetings and support groups that are doing things virtually or over the phone. But I do hear loud and clear the concerns and need to be face to face. It is certainly difficult during these times and something that we're concerned about as well. Okay, any other announcements?
I have one thing to announce. This is Eric. I don't know if the group knew, but the International Convention of AA was to be held in Detroit, and that is a worldwide convention where over the July 4th weekend, everybody was going to come to the TCF Center downtown Detroit. I mean, it's just a remarkable event apparently, and naturally that got canceled. I don't know if it's been, maybe Kelly knows if it's been rescheduled or if there's any updates on it, but it's it's too bad. It's an opportunity that the Detroit community lost to host such a great event because of the virus. It's really too bad. I was in California and people were telling me that they were coming to Detroit to go to the event, and it's really disappointing that we're going to miss out on that opportunity.
Yeah, this is Kelly. I don't think it's possible to reschedule it. They start planning, like the entire city of Detroit, Dearborn, all the way out, every single hotel they had reserved. I don't think it's possible. I think they have to start planning 5 years in advance because it's every 5 years. So I highly doubt it'll be rescheduled.
What a
That's
shame.
my concern. Yeah, what a terrible shame. And that's my concern again. Going back to the hotel, motel, whatever you call the new center, Cobo Hall, it's hard for me. Tax, we're losing out on all that money, and it makes me sick. Okay, anything else from anybody else? Christina, do you have anything else you'd like to say? I know.
Yes.
But
no, I was going to say that we should have a lot more updates in July about what we're doing. Certainly, I'll give a large update about the Michigan Department of Corrections services that we've taken over managing, and I'll give an update on that in July as well. But right now, as Anya and Nicole and everyone has mentioned, it's been all things COVID since really the beginning of March. And so at this point, I think we'll hopefully be back to a bit of normalcy in July and give you a full update on everything that is going on then.
Yes, and I look forward. Maybe we can all meet Eric in July in person. Does that sound good?
It would be great.
I'd love to get out of the house once.
Yeah, me too. Okay, anything else from anybody? Everybody please stay well, stay safe, do what you have to protect you, your family, and your neighbors. Anything else, Christina?
Other than if we had just any additional public comment, I know that I was asked to offer that twice. So before we end our meeting, if there's anyone in the public that is asked to or has a desire to comment, this is your time and we welcome that. Okay. With that, I don't have anything else. I'm not sure if any other person does on the team, or the board. But if not, then I know I am completed with my portion of the presentation, as has everyone else.
Thank you all. Christina, thank you. Thank everybody on the staff for the amazing work that you're doing in an unprecedented time. I think that, Christina, all of our meetings kind of blend together, quite frankly, over the years. This one will be well remembered.
Right. Right. Well,
Thank you
stay
very
safe,
much.
I agree, and thank you, everyone, and we hope to see you in July.
Okay, in person.
Thank you. Yes.
Thank
Okay,
you.
take
Bye-bye.
care, everyone.
Bye-bye.
Bye-bye.